Hello, this is Olivia Goodwin. I'd like to introduce Elizabeth Stein. She's Membership Coordinator for the Medical Tourism Association, and she will be presenting today. Elizabeth?
Thank you, Olivia. Yes, my name is Elizabeth Stein, and I'm with the Medical Tourism Association, and I'm currently the Membership Coordinator. Today's webinar is the Tourism Board's role in medical tourism and health and wellness promotion. First, let me introduce you to the MTA and its three tenets. First, the MTA believes in transparency. We seek to provide transparency in both the quality of care and also the pricing of care. Every day we see more and more that the globalization of healthcare has created a very flat world. So we exchange technology, information, communication to physicians and patients. Our second tenet revolves around communication. The members of the Medical Tourism Association have agreed that communication is the key to success, particularly with respect to ensuring positive patient outcomes. They have all agreed to put competition aside and work together to resolve the issues one by one and address them as they arise. Our third tenet, which is very important, is education. The MTA strives to provide education to anyone with any interest in the medical tourism industry. We use various means, media, these webinars, conferences, through our Medical Tourism magazine, and also through our Health Tourism magazine, as well as our new website, medicaltourism.com, geared towards consumers. Some of the Medical Tourism Association's platforms and activities are shown here. First, we have our Medical Tourism Association membership. We have our Medical Tourism Association Congress, which will be held in October in Chicago, and I'll address more about that in detail in a few minutes. Our Medical Tourism magazine, as well as our Health Tourism magazine. Webinars such as these, fan trips. The goal of a fan trip is to really highlight the quality of care within a specific region. And we're going to go over this a little more later as well, because this really does involve our tourism boards. Quality of care projects, 5 certification programs, promotional programs, research and surveys, and consultancy programs. As I stated, we have about 5 different certification programs available exclusively to our MTA members. If you'd like any more information about that, I'd be glad to go over that with you. And I'll be giving you my email address at the end of this webinar. The Medical Tourism Association is the only nonprofit association in the medical tourism industry. The MTA has offices and representatives in over 10 countries, including Seoul, Korea, Costa Rica, Istanbul, Turkey, as well as Tel Aviv, Israel. The MTA also works in over 90 countries. We have approximately 300 members across the globe, and our publications have over 120 global readers. This is our Medical Tourism magazine throughout the years. We've really come a long way. We're known as the voice of the medical tourism industry, and we provide our members and key industry experts with the opportunity to share important developments. It includes initiatives, themes, topics, trends, all that make the medical tourism the booming market it is today. Some editions are available in print. All of them are online. We also have our sister magazine, Health Tourism magazine, which is geared to consumers. This is a bi-monthly online publication, and it's completely dedicated to the education and awareness of health, prevention, wellness, alternative, and medical wellness issues. We also offer destination guides. Now this is very important to our tourism boards because these destination guides feature an exclusive focus on a destination, country, or city containing detailed information about the quality of healthcare, the healthcare infrastructure found in that region, and this includes full-color photos of the opportunities in each destination. It includes information on hospitals, clinics, wellness centers, culture, hotels and hospitality, and other tourism activities. So what is the definition of medical tourism? Simply stated, it's when a person travels from one country to another or within their own country for medical treatment based upon their perceived personal value. This includes affordability of care, accessibility, availability, and of course quality of care. This added to the patient's perception of tourism gives you their perceived value. Some of the medical tourism drivers and factors are shown here. Because the world is shrinking, increased global access and affordable transportation assist in the growth of medical tourism. We have also seen an increased demand for medical, surgical, cosmetic, and dental procedures. Global establishment of quality standards. This includes JCI, the accreditation body for international hospitals. Acceptance by employer and health plans. We see more and more employers realizing that medical tourism can save not only the company but insurers money. So what services do these medical tourism patients seek? Some need orthopedic treatment, hip surgery, knee, back, and spine treatment, minimally invasive treatment. Others are looking for dental treatment, whether it be routine, implants, veneers, crowns, or extensive dental surgery. Bariatric surgery, including third gastric sleeve, gastric bypass, and also the lap band. Executive health checkups. These are annual executive health screenings that are done. Rehabilitation and geriatric, including treatment of acute and chronic conditions and geriatric care. The Gallup poll of May 2009 showed that 29% of Americans will travel for medical tourism, and not just for cosmetic surgery. For medical procedures such as heart bypass, hip or knee replacement, and even cancer diagnosis and treatment. A Deloitte 2009 poll shows that 62% of Canadians will travel for medical tourism, 59% for elective surgery, and that's 62% if the surgery is necessary and paid for. So what is the role of the facilitator and/or travel agent in the world of medical tourism? Well, as you might think, of course, they're responsible for the travel, airline and local transportation between the hospital and their stay. Healthcare, identifying the healthcare that's within that destination, negotiating the price with medical providers, and also monitoring the quality of care found in the destination. Tourism and concierge service, including translators, tourism-related arrangements, that is, arranging tourism according to the patient's mobility, either before or after their surgery or medical treatment. The facilitator and travel agent are also responsible for the documentation, getting together the legal documents needed for travel, the patient's records from one doctor to another, and possibly submitting claim submissions and reimbursement from the insurance company if covered. The role of hotels, being able to give transparent pricing in their packaging and services, also offering the correct dietary menu, privacy, modifications, nursing support, and entertainment if the person does have to stay indoors. Again, tourism and concierge with relation to translators in that country, personalized service, appropriate tourism, and transportation back and forth to the doctor for any follow-up treatment. Hotels' communication with the patient is very important. Their staff must be sensitized to the needs of the international patient, understand communication, and also have emergency response in place. So why can tourism boards play such an important role in the growth of medical tourism? Well, you tourism boards know the high-quality health care that you have in your destination. and you have the right perception of that destination. You're aware of the tourism benefits that you can afford, and you also know what health care is available, good, quality, affordable health care. This is the Tourism Board's chance to shine and rise above all others to display their finest qualities. Now, we don't want you to wait. It can be years to build your brand. So what do? Marketing. You have to be aggressive to start marketing and brand your tourism board. Don't wait until you have all the pieces of the puzzle together. Start now. The value of medical tourism and health and wellness for destinations is incredible. Some research that has come out has found that Costa Rica, the medical tourists spend 5 times the amount of normal tourists in the economy. Almost 85% of all medical tourists travel with a companion, and both the companion and the medical tourist will stay on an average of 2 to 3 weeks. Both will spend a lot of money, but the companion of the medical tourist will be spending even more. Now in Thailand, they report that medical tourists and companions spend 20% more per head than normal tourists. So how can we here at the MTA help you, our tourism boards? Well, one of the great ways is to attend our 4th World Medical Tourism and Global Healthcare Congress that we spoke of earlier. This year, it will be located in Chicago at the Marriott Renaissance Schaumburg Hotel. Why Chicago? Central location. Some of the largest employers in the U.S. and globally are situated here in Chicago. We have some fantastic speakers this year as well. Bill Rancic, the winner of The Apprentice, Honorable Professor Peter Anyang, the Minister of Medical Services, Dr. Robert Ray from Dr. 90210 on TV, and Dr. Cecil Wilson, who's the President of the AMA. So why should you come and exhibit? Well, we're going to have up to 140 exhibitors and sponsors, representatives from over 87 countries with insurance companies, providers, and facilitators, all looking to send their patients overseas. Will they want to come to your destination? You won't know unless you're there. I'm showing you some of our exhibitor testimonials from a few years back. You can see this is a fantastic event in medical tourism. It's a great opportunity to network and meet people that you never thought you could meet. The networking opportunities are number 1. This year we've partnered with some people from Microsoft, and they've put together a networking opportunity for us. The entire group is going to have up to 10,000 one-on-one pre-scheduled networking meetings, including buyers of healthcare, top international hospitals, medical tourism facilitators, along with insurance providers and companies. 1,500 attendees from over 87 countries. Yep, that's exactly what we expect. 100 expert speakers, networking luncheons, and cocktail receptions. These are all important to your business. We are also offering buyers of healthcare a VIP program. That's where insurance companies, people from the government, employers, and insurance agents may be eligible to get a free registration or a discount registration, or perhaps a hotel room night or a flight offered by the MTA to attend the Congress. Here's some testimonials from some of our past buyers of healthcare. I love the second one. You can't appreciate the length and breadth of the medical tourism industry until you get all those folks in a room and listen to their shared experiences. It is an absolute must for any medical provider looking for global reach for their services. And you want to be there, don't you? Here's some additional buyers of healthcare testimonials. The conference offered a splendid opportunity to interact with a diverse group of participants and hear the latest thinking on medical travel and global networks. Our new networking software is rated the best of attending the conference. You can request dozens of these private one-on-one networking meetings while at the conference and network with all these people we've spoken about. You put your photo in bio, add your interest, add tags so people can find you. Just like Facebook, request your friends. You can also link up your Twitter, LinkedIn, and Facebook accounts. You can find out who will be at the conference and add your Twitter feed to your profile. You'll receive email notifications for any new meetings. We also have mobile networking for your iPhone, your BlackBerry, or your Android. All the information you need without a computer. You'll have a personalized conference calendar, and this year there is no shutdown period. The networking software will stay open during the conference and at least 2 weeks post-conference. Now, there are 4 integrated conferences within our 4th World Medical Tourism and Global Healthcare Congress. The Global Benefits Conference, Healthcare Development and Sustainable Healthcare, Global Healthcare Investment, as well as Health and Wellness Conference. The Global Benefits Conference aims at streamlining benefits and processes for multinational employers and insurance companies. So here we're targeting the highest level executive attendees involved in this industry. The people that will be there are shown here. International insurance agents and consultants, multinational employers, air ambulance companies, and the like. Their website is shown here for you. Healthcare Development and Sustainable Healthcare Conference. The theme for this conference is groundbreaking approaches to healthcare design, management, and sustainability. The focus here is on international healthcare and hospital development with case studies from different parts of the world. The Global Healthcare Investment Conference. Here you can network with investors as they learn about international investment opportunities in the healthcare sector. Our focus here is on emerging markets and trends, showing case studies of investment opportunities in the healthcare center. And our Health and Wellness Conference. Millions of consumers are taking vacation for health, wellness, and prevention. Tourism boards, remember this. The focus for this conference is the growing health and wellness tourism industries. We're going to show you the regions that create strong wellness programs attracting individuals and employers to their regions. Now that's something to be a part of. If you'd like to register, here is our website. And again, my name is Lisbeth Stein. You can reach me at lisbeth@medical